So this was about the baroreceptors. Now the second one, so here this is short-term regulation, seconds to minutes. Now we would have maybe minutes to hours, and in here RAS. So RAS system is important. So if there is a decreased sodium supply at the distal convoluted tubule in the nephron, or decreased blood pressure, so renin would be secreted. Renin. Then renin would convert angiotensinogen into angiotensin 1. Okay. So angiotensinogen is a protein which is synthesized by the liver. Now angiotensin 1 would go to the lungs, and there's an enzyme called angiotensin 1 converting enzyme, ACE, also known as ACE, and angiotensin 2 is produced. Now angiotensin 2 is a very potent vasoconstrictor, as well as it causes the secretion of aldosterone. And aldosterone, of course, it upregulates the sodium potassium ATPase pump inside the nephron, and there is increased sodium reabsorption. So if there is more sodium reabsorption, remember, whenever there is more sodium, water follows sodium. So there will be more water also reabsorbed, and the blood volume will be increased. So it has dual effect here. The blood volume is increasing, so the preload would be increased and the stroke volume would be increased. And here vasoconstriction would have increased resistance and more pressure. So this dual effect would also want to increase the blood pressure. So this is intermediate regulation of the blood pressure through RAS system. Renin, angiotensin 2, aldosterone system, RAS. It's very, very important. So in terms of pathophysiology and in any medical license examination. And the last one here, of course, is antidiuretic hormone, but the long term. So this was short term, intermediate, and the last through other hormones, through aldosterone, through ADH, actually kidney. So the last one, which regulates in long term, maybe hours, days, weeks, it depends on the underlying condition. So for example, if there is heart failure, the heart is not pumping adequately, so blood would not be reaching kidneys adequately, renin would be secreting, and this system would be activated, and it would take, why? Because actually the underlying cause is heart failure. If you treat the heart failure, this would automatically be regulated. So kidney is long term, and it has this effect of regulating water regulation, of course, water input and output, or you can say the regulation